Good morning, everyone. I'm Matt Brocious. I'm the Vice President of Finance here at Home Assist Health. I want to take the time this morning to talk to our caregivers and our public audience a little bit about what we do here at Home Assist Health in our department, as well as personal protective equipment, PPE, and then spend some time talk about budgeting and how that can help, especially during these times with our current pandemic that we have going on. So first off, I talk a little bit about our department. Handling with finance, that means it's overseeing anything financial, payroll, IT, and facilities. We have a great team here. Ruben, who is our IT and facility manager, does a wonderful job. Marcelo is great as our finance manager. He helps oversee anything accounts receivable, payroll, billing type questions and issues, as well as EVV troubleshooting for our caregivers. And then we have our wonderful payroll and accounts receivable staff with Kim, Wileen, and Jeannie, and they're so great. So I definitely, if you ever have to reach out or have questions, definitely reach out. That's a mess up.
Three, two, one.
So definitely reach out, and if you have any questions, talk to one of our awesome team members.
Perfect, Matt. We appreciate your time in doing this. Let's just get started with PPE, personal protective equipment. Can you explain a little bit what that is, and then what has Home Assist Health done to ensure everyone is aware of that?
Yeah, absolutely. Great questions. So PPE is definitely important during these uncertain times that we're having with COVID-19. When COVID-19 first started earlier this year here in 2020, we reached out and tried to acquire as much personal protective equipment, PPE, as possible, as quickly as possible. But there's been a number of shortages all throughout the world, and especially when it comes to gloves and masks. The demand has been high, as everyone can probably imagine, due to the need that everybody has and all the requirements that have been needed. But at the same time, we want to make sure our staff are safe. Staff not only here in the office, but also our DCWs that are going out in the members' homes. We want our members to also be safe as well. So we want to make sure every caregiver, DCW, they get cloth mask, they get disposable masks, hand sanitizer, and gloves. All important things to make sure that they're safe when they're going out to see the members in the homes. We've also supplied all of our members a cloth mask, and recommend if you need additional masks for our members, you call the telephone number for the Haynes Company, which is 1-800-503-6698. And if you need that information, you could take a look. We've had it posted on Facebook. We've also have it posted on our blog on homeassisthealth.org. You can find that information. Or again, call our main office number and reach out and ask for that information.
Matt, what if they use up all their surgical masks? Are those things that we continue to replace, or do they need to go somewhere else for that?
Yeah, so right now we're actually we're actually providing additional refills for everybody. You can reach out to your supervisor, your member care supervisor, and or call the main office, and they'll put you in touch with someone in the program department to make sure that you can get a refill of those disposable masks. So again, we do want you to be safe. We know that the cloth masks sometimes are uncomfortable to wear, make it hard to breathe. So these disposable masks being able to be replenished on a regular basis. Along with also making sure you reach out. If you do need gloves, please make sure you stop by, make an appointment to get a replenishment on gloves, and or those can be handed out and delivered by your member care supervisor.
Perfect. So you talked a little bit about EVV also, electronic visit verification. We all know that's a big thing with the state of Arizona, and we have some deadlines coming up. Can you talk a little bit more about that and maybe continued expectations from the company?
Sure. So we've been live with EVV, electronic visit verification, for some time now. As the state is going to be having that required to go live with them on January 1st of 2021, it's going to be imperative that everyone continues to be clocking in and out on their schedules, utilizing our app, as well as calling in on the telephony service. We recommend, again, if you're having issues with the app and or the call-in line that you're reaching out either to your supervisor, someone within program, or if you need further troubleshooting assistance, we ask that you make an appointment to stop by our office, and one of our team members here in finance can assist you, and or someone from the program department. It's key that you clock in and out on EVV because that is how you get paid. So we also make sure that you get an accurate payroll every 2 weeks. And so therefore we want to make sure that you're taken care of. It's also important with EVV if you are utilizing one of our new benefits, which is called RAIN. If you haven't heard of it, it's a pay advance program where you can basically work today and get paid tomorrow. You can submit a request through the application. It's RAIN Technologies. You can go onto the application, which is found in either the Apple Store or the Apple Store or the Google Play Store, and download that application and be able to request those advances. And then for a small transaction fee, you can have access to your funds immediately instead of having to wait every 2 weeks for payroll. So again, it's important though to be clocking in on EVV because that is how your pay advance request is approved, because it is due to being based on verification of your hours worked. So again, if you have any questions on the RAIN app or the pay advances, we would just ask that you call our main office, and you could ask to talk to either Marcelo and or myself, and we'd be happy to assist you with the application. So with all of those things, one of the special topics we want to talk about today is budgeting. Right now, especially with the pandemic and a lot of the uncertainties, it's very important to understand how much money you have coming in and where your expenses are going. So therefore, you can help in making sure if anything comes up, urgent emergencies like a dead battery in your car, or you need additional costs for some kind of expenditure, you just understand really how much money you have coming in versus how much money you have going out. And it's a tool not only during the pandemic that can be used, you should be utilizing it during all times. So it's very important. So what we've developed is a sample budget. You could actually find, we have a spreadsheet that we can send out. It's a template that'll help you input all your income that you have coming in. So that's all your pay or your expenses that you have that are going out. So that with the net of the two, you can figure out how much money you are having left over. So with today's presentation, though, we have a little demonstration of, we'll transition over here onto the whiteboard, and we'll take a look, and we'll see where we have a sample, basically of a budget. We want to show, for a budget, you want to figure out how much income or how much money you have coming in. So that's how much you get paid on a regular basis. And in the case of a budget, it's typically done on a monthly basis. So in the case of this person, as an example, their monthly income is $1,500. And then they went through and listed out all of their different expenses for the month. So housing, that could be rent and or mortgage or whatever you pay in on a monthly basis for that. Your utilities, so your electric bill is typically what would fit into there. Your cell phone, most people all have a cell phone, and if you're using EVV, you probably have a cell phone as well, so you have that monthly bill. Any kind of debt or credit cards that you owe on, a car payment if you have that, insurance for your car, so if you have vehicle insurance, that's what we're talking about there. Your groceries, gas, and then finally your entertainment. So your extra money, if you dine out with fast food, if you go to the movies. I know a lot of us have been stuck at home, so that entertainment bill's probably been a little bit less for everybody. But again, as we've kind of opened up things and you're out in the public, you might have a higher entertainment expense. So you add all of these expenses up and you come up with a total, which in this case is $1,400. You subtract that from your income, and in this case you have $100 left over. So that $100 can go towards being put away for savings, for anything that you might owe in the future. You might want to budget for, if you do have a car, you have to pay for the vehicle tags on it once a year or twice a year, depending upon your situation. So you can put that money away, so therefore when it comes up, you're able to pay for that without wondering where you can cut back in other areas. So definitely, if you have any questions or need advice or input, we want to be here. We want to be available. This is not normally a service that that is available to everyone, but we want to make sure that you as an employee at Home Assist Health is doing well during this pandemic, so we wanted to put this out there for you. So again, if you have questions or would like that spreadsheet, reach out to our main office number and they'll put you in touch with me. Again, I'm Matt Brocious. Would definitely want to help you and want to make sure everyone stays healthy and safe. Thanks everybody.